joining. Let me see if I can find it. All right, it's going to
It's
be a
it
poll.
it's so funny, Jody. Jody doesn't want to make anybody sick, so she's going to be in the background.
Well, it's interesting. She's been sick. I know people in Colombia who've been sick with the same strain. Like it really is contagion. Things travel so fast.
It's like I'm wearing my mask.
Yes, that's very
Good. So I
cool.
won't get sick.
Right.
Hello, Randy. Glad you're here. All right, here's a question. You can type your answer in the chat. It's a poll. I don't have anything physically set up, but if you were going to, which one of these do you think you want to learn most about today? We're talking about fatty liver disease. Type A, B, or C in the chat. A, what causes fatty liver disease? B, how to know if you have it, or C, how to reverse it naturally. So that's the poll. I will repeat it as people are more joining in. More people are joining. A poll about fatty liver disease. Put A, B, or C in the chat. A, what do you want to know about? A, what causes fatty liver? B, how to know if you have it? Or C, how to reverse it naturally? Randy's like, Randy Lance, A, B, and C. That's smart. A lot of C want to know how to reverse it naturally. While, what else are we here just for remedies, right? B and C, Sally says. All right. Some of you people who've never put anything in the chat, it's harmless. Put something in the chat. All right. While you guys think about your answers, we do have a few uh, housekeeping
Housekeeping.
things to go over. So we have the disclaimer, which is going to be cued by Jody. I'll read the disclaimer. If it doesn't show up, I have it in front of me. Basically, our webinar is brought to you today for informational and educational purposes only, not intended to substitute any professional advice, diagnosis, or treatment you receive from a health professional. Always seek the advice of your physician with any questions you have regarding a medical condition, and never disregard their information or delay in seeking treatment based on something you've seen or read or heard here today, but absolutely put everything into place. All right, if you have a question, you're going to do that in the Q&A. So we're going to use the chat to talk. Feel free to put, hello to everybody. But if you have a question, please put it in the Q&A. So it's down at the bottom. There's a little box with a little question mark in it. You're going to do that. If you don't see it, you're going to click on the three buttons that say more, and then you'll pop up with like 6 or 7 other options, and the Q&A will be there. If you're doing this on your phone, it'll look like a little chat. The Q&A is at the bottom as well. So we will take your questions. And Dr. Saunders loves to take your questions related to fatty liver disease or not. So feel free if you come with any other questions, we want to answer them. And if you've had any positive results, anything you've learned that's been like a light bulb, anything that's been beneficial from taking our supplements or reading our solution kits, please let us know. Do so by emailing us at support@bartonpublishing.com. We want to hear how you've been impacted. And so please let us know. That's probably the hardest thing to do is to share, but it's kept confidential. So don't worry about that. All right. So I'm going to look at the chat. A lot of C's here. Learning how to reverse fatty liver disease naturally. So let's start from the beginning. What is fatty liver disease? We want to make sure everyone's on the same page. So put it in plain language, Dr. Saunders. What's the difference between alcoholic and non-alcoholic type fatty liver disease?
Okay, so that's a really important distinction because fatty liver disease is caused by toxicity in the liver. And for many years, it was noticed that people who drank a lot of alcohol got fatty liver. Well, why does that happen? Well, because alcohol is a toxin in the liver. And because it destroys liver cells, then they get replaced with fat, and so you have this fat in the liver. So that's called alcoholic fatty liver disease. Well, then they noticed that some people who don't drink also get fatty liver, and they're like, what the heck? You don't have any you're not drinking alcohol. How could you possibly have fatty liver? Well, it turns out that something changed in the environment. Something changed. That before the people had access to alcohol and they would drink alcohol, and if they drank a lot of alcohol, they get fatty liver because of the toxicity. But um, over time, we started getting things like high fructose corn syrup and sugar put into everything. And then even like honey and everything tasting sweet and people drinking sodas. And the sodas have high fructose corn syrup in it. So you can already guess what's going to happen. The fructose is not sugar. People think it's sugar. It's not sugar. It's sweet. It is a type of sugar, but it's not used by the body like sugar. It's not glucose. Glucose goes into your cells and gets cut and broken and then goes through what's called the Krebs cycle and makes energy. Fructose doesn't do that. It has to be made into something like fat and then be broken down in that way. And so it has to be processed. And that processing has to be done by the liver. There's no other way. So when you are dumping tons of fructose in, if you put a little bit of fructose in there, not a problem. But if you put tons of fructose in there, you're gonna get fatty liver. So I've told you the story about the hibernating bears, right? Hibernating bear comes out. Oh, gosh, I'm really hungry. I'm hungry as a bear. So goes out and just starts eating like crazy. And then later on in the summer, the berries come ripe, and a bear will eat 100,000 berries a day. Like, you know why? Because with sweet, there's no stop mechanism. So if he was eating meat, he would eat meat and he'd be done. Ugh, my stomach's full. I'm done. But with berries, there's no done. You just keep eating more and more and more. And so we see this, people get it gaining weight and they're going, why am I gaining weight? Because there's no stop mechanism with sweet. So the bear keeps eating all these berries, and guess what the berries have in them? Fructose. And the bear gets fatty liver disease and gains 250 pounds and then goes in and sleeps for 6 months. Why? Because he doesn't have any energy, because all of his energy's been well blocked because of the fatty liver disease, the insulin resistance. So people do the same thing, but we don't go and sleep and fast for 6 months. Actually, I've had plenty of people fast for like 30 days and do that, and they do really well with that. So fatty liver is perfectly normal and natural. That's what bears get. That's what every day sucking all the sugar. Hummingbirds are eating sucrose, which is 50% fructose and 50% glucose. And guess what happens to their liver by the end of the day? They get fatty liver. And so it's not unique. It's not just toxicity. It's not just like, it's not a bad thing, really. It's just that it means something. It means your metabolism is messed up. That's what it means.
All right, so it's often been like there are many things I feel like in the medical world that gets called the silent epidemic. And I
Yeah.
think fatty liver disease is one of those that's called silent. So if people are unaware of the status of their liver, we can't see it, don't know if we have fatty liver, how widespread is it, and why should people pay attention to this webinar?
Dang, nobody knows how widespread it is, but it's really important. And if you're looking up numbers and your AST and ALT, they're called liver enzymes, are just a little bit elevated, like they're over 30. Over 60 is hepatitis of some kind, right? They're over 30, but they're not over 60, and they're just kind of in that range of they're high but not too high. You probably have fatty liver. The ideal place for the those liver enzymes to be is under 30. They should be in the 20s or teens. And if they're over 30, that's something to consider. But an ultrasound of the liver will often show it. And it used to be just incidental. Oh, we're looking at the gallbladder. Oh, and by the way, you also have fatty liver disease. And it was just kind of like a secondary thing. Um, but it's a real problem and it's very common. And you can imagine, like the bear gaining weight from eating all the berries. That's perfectly natural sugar. People go, well, I only eat natural sugar. I eat natural fruit. Well, yeah, that's still got a lot of fructose in it. That's still going to cause fatty liver.
Well, I wish I could take a 6-month nap like the bear, but I can't. So, what are some other warning signs that might say you have fatty liver disease? Because really, if you're not taking those tests, are there any like symptoms to look for?
Yes, there are, but they're kind of subtle. So when your waist size gets bigger, for a man, your waist should be right around 32. And for a woman, your waist should be right around 30. And that's not different in different people because you can't say, well, I have a big bone, so bone structure. No, there's no bones there. That's just waist. The waist is all everything that's in your abdomen. So what's in there? Intestines. Well, everybody has the same amount of intestines. Liver, yeah, your liver's about the same size. Kidneys, yeah, kidneys are about the same size. Spleen, yeah, that's about the same size. So what makes some people have a big belly and some people have a little skinny belly? Um, Fat. And so when you're getting that abdominal fat, it's very likely you could have fatty liver disease.
Hmm. So many people think, okay, so it's a fat issue. A lot of people think it's resulting of too much drinking. So, is fatty liver the same as people if they're drinking too much?
No. Okay. So in with alcoholic fatty liver disease, you probably won't get the central obesity. It's that's just the toxicity of the alcohol. But we often don't think of something like fructose as toxic, but it does get toxic when you get overload the liver with it. So what the fat is not is the fat the abdominal obesity, having a big belly is not the cause. It's not fat that's causing it. It's sugar. It's fructose specifically. That sugar is causing the problem, the fatty liver. So you could be really obese and not have fatty liver and you can be super skinny and have fatty liver. So it's not either or. But one sign is if you're getting central obesity, your waist size is getting bigger, then it's a likely problem because it's very likely just because in our society we have so many sources of fructose that
Right. So it's not just about eating the amount of blueberries that a bear might eat. It's really
yeah.
the diet that's of sugar, refined foods, ultra processed, high fructose corn syrup that's going to cause fatty liver, which makes
Yeah.
sense. Is there a connection between fatty liver and other metabolic diseases like diabetes, um,
Yes.
high
Absolutely,
cholesterol?
absolutely. In fact, we call it metabolic syndrome. But the metabolic syndrome didn't include fatty liver, but it's often part of it. And that is high blood pressure, and central obesity, high cholesterol, and insulin resistance. So that combination of factors, fatty liver is commonly associated with that. It's not always there, but it's very commonly associated. What's really interesting is some people just don't tolerate fructose very well. And they don't have diabetes and they don't have central obesity. They still get fatty liver from drinking sodas or something like that or eating things that are sweet, high fructose corn syrup, or just like naturally, like mangoes and pineapples have a lot of fructose in them. So, and it's because they don't tolerate it. Well, there's a couple of enzyme, an aldolase and a fructokinase that if those enzymes are slow, then the liver gets toxic on fructose pretty easily. And We like to think that enzymes are a yes or no question. Yes, they work. No, they don't. But really, there's a whole gradation. So some people are really sensitive, and some people are not sensitive at all. They could just like they could down sodas with high fructose corn syrup, 6 pack a day, and not have any issues.
Hmm. So is there a spectrum with liver disease, like fatty liver then?
Absolutely. Absolutely. It's a spectrum. So you can have a little bit, you can have a lot. And the best way to deal with that is what everybody wants to know. That was C, right?
Yes, it is. The remedies that work. Well,
Yeah.
first, I want to ask you before you get to the remedies. So obviously, we deal with people who have high insulin problems like diabetes. So we recommend Synachroma. Is that going to help someone, or Berberine? Is that going to help someone who has high fatty liver disease? Or is it too late?
No, it's not too late. It's the diet is more important. So the things in Synachroma help you use glucose well, and that allows you to use insulin better. And that's the glucose insulin, that connection of the energy part. Fructose is an entirely different process. It's processed way differently. So that's not specific to that.
Okay, one more question before we talk about how to solve this problem. Can you get fatty liver disease from like medications? Or is it
Uh,
just liver damage from
well,
medication?
it's liver damage, and some medications do that. Some medications, if they mess up the metabolism of the liver, metabolism meaning how the energy is produced, problems in the mitochondria where the energy is produced in the liver. So any damage to that can cause fatty liver. So you have things like there's antibiotics that destroy mitochondria. They're called well, floxacins, gadifloxacin, ciprofloxacin, um, and those antibiotics are toxic to mitochondria. And then when the mitochondria don't function, and then you put a bunch of stuff through the liver can't process it, and you end up breaking down the cells and getting fatty liver. So there are other things, and usually the medications that are toxic to the liver, it's because they destroy the mitochondria or destroy the energy production.
Mm. Well, like you say many times before, medications are toxins just
Yeah,
in general.
yeah.
So be careful with those. Um, and then, okay, so if you're worried about fatty liver disease, how do you find out if you have it? Is like you said earlier, sometimes it's just oh, look, you have fatty liver disease, but is this something people should be testing regularly for?
Um, Regularly? Well, no,
Yeah.
not really. Not really. If you test for it once, if you suspect it, so
Okay.
when you have your blood test, you're going to get those liver enzymes. If liver enzymes are a little elevated and you're worried, that could that be fatty liver or could it be something else? Then, because liver enzymes are indication of a high turnover of cells, and that means cells are dying. Um, so uh, so then you can go, okay, maybe I can do an ultrasound to find out. But you don't have to know. It's kind of like the hummingbird doesn't have to know that it has fatty liver in the evening, because it's gonna fast for 12 to 15 hours, and that's all gonna be used up and go away. The bear doesn't need to know that it has fatty liver before it goes in and hibernates for 6 months. So you don't have to know to fix the problem, because if you say, well, my liver enzymes are a little bit elevated, and so there's a metabolic problem, so I need to fix the metabolic problem. So fixing the general issue. Unless you happen to be an alcoholic, then you might want to know that too.
Hmm. All right, now it's time to get to the number or level. Can I speak? C, the remedies. Can you reverse fatty liver disease, and what does that look like then?
Yeah, it's not that hard, and the amazing thing about it is it's free. There,
Mm.
there's there's no, like, people go, oh, fatty liver, I need to start taking all these supplements, and they get all these liver supplements, and I've been on my YouTube channel. There's like uh, every day there's like 10 ads for some liver drink. Somebody says, "Oh, yeah, I drink this and it fixes my liver." Why? Well, because it has milk thistle in it and all these nutrients that for glutathione and all this stuff that my liver needs to detox. Yeah, okay. So, milk thistle is something. It's been shown to help the liver. In fact, we put it in our berberine for the same reason, because people taking berberine, they usually have metabolic problems, and the fatty liver and milk thistle helps that. So it's a thing. So that is one supplement that you could take for fatty liver. But the point is that I was making is it's free, meaning it's not required. There's the fix is not the pills that you're taking. The fix is to lower insulin, reducing fructose specifically, and fasting and movement. So you need to use up the fat in your liver, use it for energy. How do you do that? Well, you train your body to burn fat for energy. So we're constantly training our bodies to burn sugar for energy because it's the preferred fuel source. You get quick energy. That's when I was a kid, we used to, what was that? Sun-made raisins, the fastest energy in the
Mhm.
West. That we quick energy from sugar.
Mhm.
And it can be natural, but that's still sugar. It's still quick energy. And every once in a while, train your body to use fat for energy. So if you look at the diabetes solution kit, what is that? That is the whole program is a program on how to train your body to burn fat for energy. That's what it is. That's what it does. And that's lowers insulin, you're reducing sugar and fructose. And then there's one other thing you can do that will absolutely use up all that, and get your insulin down to zero, and use up all that fat, and that is fasting. So doing something like a 3-day fast is a quick way to get your body into fat burning mode, and use up the fat in your liver.
What about since fructose is a major problem, what about just like going off sugar for 30 days?
You know what? That helps too, and that's a useful thing. So 30 days might be enough, but if you're still eating other things, I don't know if you get off all sugar, meaning no fruit or anything.
Mhm.
Yeah.
Mhm.
Yeah. There's really a limited, like fructose is everywhere. It's not like just in a few places. Um, there's a few things that you can eat that have no fructose in them that, fish, meat, eggs, cheese. Okay. All of that stuff. No animal products, no fructose, right? And then a lot of vegetables have fructose in them. So, but the things that you can always rely on, anything leafy. So, kale, spinach, lettuce, all of that stuff, anything leaves, has very little, if any, fructose. Broccoli, cauliflower, cucumber, zucchini, those have very little, if any, fructose. The fruit you can eat that doesn't have fructose would be like peppers have some, but it's very little, and avocados have very little. So those are some ideas of like fruit and vegetables that you can have, that don't have fructose in them. So you can easily, and you can easily go off of fructose. And so if you did that for 30 days, I don't know, that might be enough.
Well, Jody posted a link to the diabetes solution kit. Some of you might be familiar with it. If you're not, Dr. Saunders talked about it's a easy protocol to follow, except it's not when it's not.
Okay.
It does require you to lower your carbs, but it's a great resource to you if you want something to help you because we all know what to do, but how many of us do it? So this is something to help you keep accountable. So there's a link in the chat, and also Jody posted a coupon code webinar, no, Saunders 25 for 25% off that or anything else you want to purchase. Other question, what about inflammation? Is that like, should we address inflammation? Because I imagine fructose makes us all inflamed. So something like we have turmeric, would that be helpful to reduce the inflammation?
Yes, inflammation is a part of this, and the reason is because the things that are inflammatory also cause like the cells to die in the liver too. So it's not all one thing. You can have toxicities for other reasons. If someone has hemochromatosis, then their liver fills up with iron, and iron is an irritant and damages and causes inflammation and damages the liver, causes a fatty liver too. So, so it's not just one thing. The reason I brought up the fructose thing because that's very common, but I also mentioned generally toxicity, right?
Mhm.
That kind of thing. So, inflammation is an issue, and lowering inflammation is so important. You think about the diseases that we deal with today. There's so many inflammatory diseases, inflammation. So, if you get the inflammation down, yes. So, where does inflammation come from? Well, guess what? Fat produces inflammatory mediators. It causes inflammation. So if you get the fat down, then just having less fat it causes you to have less inflammation. Another thing is fish oil. If you can get a good source of fish oil, it's omega-3. And be very careful with this because a lot of people, they're giving you essential fatty acids. Well, essential fatty acids mean omega-3, omega-6, omega-9, but you can get omega-6 from any oil anywhere. In fact, most people are overloaded with omega-6, so it's not a good way to go. It's not good for you to do an essential fatty acid. You need omega-3, so just omega-3. And what that does is suppresses inflammation. So that's a great way to do it. And then you mentioned turmeric also. Interesting. So one of the things that turmeric does is it has something called curcumin in it, curcuminoids that lower inflammation, but it also prevents you from absorbing iron and prevents iron overload. So you have to be careful. If you are anemic, you should not be taking turmeric with every meal. You should have it on an empty stomach separately from your meals because it will bind the iron and prevent you from absorbing it.
Interesting. All right, we have a question from Fred, and one of our attendants answered it. So let's see if he's right. So Fred asks, "Can you get fatty liver from street drugs?" So Randy replies and says, "It's called DIFLD, drug-induced fatty liver disease."
Yes.
Can't so you can get fatty liver disease from street drugs?
Well, it depends on what's in the street drugs, and it's usually what it's cut with, but there's all kinds of drugs that cause inflammation in the liver, cause fatty liver disease by destroying the mitochondria, the energy production. And so it depends on what the drug is, and it depends on what it's cut with too, because there's a lot of impurities in street drugs that you don't know what's in them.
Mm-hmm. Right.
And s- and sometimes they use fructose.
Well, there's a lot of things in medical drugs that you're prescribed
That,
by your doctors too. Like,
that's true.
yeah. All right. Rinda asks, are life screening good tests for determining plaque buildup in arteries? How do we tell how much exercise is safe to do?
Uh, okay. With exercise, more is better. But killing yourself is not a good idea. Being a couch potato and weighing 250 pounds and then saying, I actually had a patient do this, and then saying, I'm going to train for a triathlon and start a heavy training program. He nearly died. He was well, part of it was because he was untrained, but the other part was he was taking a medication that blocked it. Um, so um, the point being that you start slow with your exercise. If all you can do is walk, great, walk. I sometimes tell people, okay, can you make it to the mailbox? Yeah. Okay. So go to the mailbox every day. After a week, go to the mailbox and then take 4 extra steps and then come back. And then a week later, take, 8 extra steps and then come back, and then a week later 10, and just keep adding a few steps each time until you can go all the way around the block, or you can go halfway around the block. Because once you get halfway, then there was that story of the three ladies on a desert island, and they can see the land, and one of them says they're going to swim all the way across, and she gets like an eighth of the way across, and she comes back. She says, "I can't make it." And the second one goes, and she gets a quarter of the way across, and she goes, "I can't make it." And the third one goes, "I can do it." And she gets halfway across and comes all the way back and says, "I couldn't make it."
All right, you mentioned a liver, like all the ads you're getting for liver cleanse. So someone asks, will a liver cleanse work? Let's say they buy one of these ad products in the ads. I don't know which one it is, but
Yeah.
will a liver cleanse work for your fatty liver?
Okay. That's a good question. Generally, the answer is no. It depends on the reason for it. So, if your fatty liver is due to toxicity of some kind, then detox things are very useful. Getting the milk thistle, the berberine, the turmeric, the fish oil, that does make a difference if that's the problem, is that if that's the toxicity or inflammation. So, yes, doing those kind of cleanses can be useful. If it's a metabolic problem, if your primary problem is like fructose, you got to go off that. If it's alcohol, you got to go off that. You can't just start popping milk thistle extract and still drink alcohol and expect your fatty liver to go away. Or if you're drinking, sodas with fructose in them, it's not going to go away if you're doing a liver cleanse. The best liver cleanse by far is fasting. So that's how your liver actually regenerates, repairs, uses up all the fat, and literally regenerates like cell by cell. The cells divide and reproduce, and you get your liver back, and until it's scarred down and completely gone. But a normal liver can tolerate a whole bunch of toxicity and come back to life. Be renewed. So, so should you do a liver detox? Well, if you did both, like if you did fasting to detox the liver and then use like milk thistle, berberine, turmeric, fish oil, those kinds of things, glutathione or something like that. And so it depends on why. Like some of the toxins, like mycotoxins found in molds. Some people get mold toxicity and they need a liver cleanse. And most of them use high doses of glutathione to get there. So if you know why you have fatty liver, that would tell you what you need to do.
Someone asks, does alpha lipoic acid help to regenerate the liver?
Yes, that's part of the glutathione. So alpha lipoic acid regenerates glutathione, which is antioxidant, which does help the liver.
All right, we have a question from Sally about berberine. Speaking of berberine, what is your opinion on capsule versus liquid berberine? Thank you for all the info you've provided all these years.
Okay, the berberine is comes from different sources. The berberine isn't like a plant, like turmeric is a root from a plant. Curcumin comes from that plant. Berberine is the thing that comes from various plants. So that there's various ways of getting it, and so there's liquid berberine also. And so when you're looking at it, look at the amount. Some people say that the liquid source is better because it's better absorbed as a liquid. And I don't know about that. I've seen those ads, but I don't know if it actually is. Some of them make claims that I don't think they can support. So whether you get it in a capsule, it's known to work.
Mhm.
Capsules, have been tested and they work. So I don't know how somebody can say a liquid is better in some way, but it might be better absorbed. I don't know.
So I've heard you talk about Berberine in the past that it's good to like be like 5 days on and then 2 days off. And then I've also heard you say take 500 milligrams of Berberine 3 times a day. So do you do that 5 days a week or 7 days
Yeah,
a week? Yeah.
3 days. Yeah, 3 times a day, 5 days a week,
Okay.
for long-term use. Yeah. If you're doing it specifically like if you're treating something
Mm,
like you want to lower your blood sugar, then you can take it continuously for several months and that's okay.
okay. All right. Randy asks, I picked up a bag of candy that had sugar free in big black letters on the front. But when I checked the ingredients, it said 16 grams of sugar alcohol. Isn't that the same as sugar?
Um, No, actually, the sugar alcohol is sweet like sugar, but it's used differently by the body, and so it's not actually sugar; it's alcohol, and so it's absorbed differently, it's used differently. So yeah, I know sugar alcohol. So I think. Let's see. Monk fruit is a sugar alcohol, and then you have xylitol as a common
Mhm.
sugar alcohol. Sorbitol. They don't use sorbitol as much anymore because people are complaining about diarrhea because it doesn't get used by the body and then gets digested in the large intestine by bacteria and it causes diarrhea. Uh,
So, do you recommend eating the sugar-free candy then?
Okay, so here's the problem that we look at with this. Is that gonna make your fatty liver disease worse? Probably not. That's nothing. But it does cause insulin resistance. So if you look at it in terms of insulin resistance, which is the real enemy these days. See, in our day, we have a problem with insulin resistance. And it's not the sugar itself. It's high levels of insulin that do a lot of damage to the body. It prevents you from using fat for energy. It blocks or decreases the glucose transport proteins in the brain and the kidneys. So people can have normal blood sugar, have insulin resistance, and already have kidney disease. Like they're losing their kidneys before they even have diabetes. And they used to say that's caused by diabetes, but the blood sugar is perfectly normal. They don't have diabetes, and yet they already have renal failure, kidney failure. So, and that's insulin. So, avoiding the taste of sweet is a good idea. If it's something that you have occasionally, that's fine. But the daily continual sweetness is a problem.
Mhm. All right. Randy says, I used to be an EMT, but a curiosity says, my sugar averages 70, 80 through the night, but once I'm awake and in pain, goes up sometimes around 200. Is this a serotonin response once I'm awake?
No, it's no, not as a rule, it's a cortisol response. So the cortisol is released by your adrenal glands, and cortisol makes you resistant to insulin. Cortisol is a stress hormone. When you're stressed, but like in pain, for example, then you're going to need more insulin to get the blood sugar in. So the blood sugar goes up, and then the insulin goes up with it to get the sugar into the cells to lower the blood sugar.
Okay. Autry says there's a slow-acting insulin that has been released requiring 1 shot a week to keep type 2 diabetes in check. Is it a good idea to use this insulin to keep your diabetes in check?
Um, Gosh, this is like a big thing. We go back and look at some of our episodes on peptide hormones. Insulin is a peptide. And it's the same kind of thing like the GLP-1 that is a switch that works for 10 minutes and then it turns off. But the GLP-1 injections last for a whole week. They're constantly stimulating those receptors for a whole week. And what does that cause? Well, all of the problems that people are dealing with the GLP-1. Their stomach doesn't work. They get gastroparesis. Their insulin goes up. They get insulin resistance. They're losing muscle mass. So it's not a good thing. Now, think of that with insulin, which is also a peptide hormone, which also works the same way. It turns on, and 10 minutes later, it's gone. It turns off. If you have that constantly, what are you going to have to do? You're going to have to eat constantly to prevent your blood sugar from getting too low. This is not going to end well.
All right. Another question. I have buildup of calcium in my one kidney and is subsequently failing. Is there any way I can reverse the buildup and restore the kidney to our normal state and function properly?
Okay. The calcium is an indicator. It's not the problem. It indicates that there is a problem in the kidney, and usually it's some kind of inflammation, breakdown of tissues. When there's inflammation, calcium can build up in those areas. Same thing happens like in the heart, in the arteries. People do a coronary calcium score, and they go, "Oh my gosh, my calcium is built up in the arteries." How do I get rid of the calcium? You don't get rid of the calcium. That's scar tissue with calcium in it. It means you've got inflammation in those arteries. Same thing. If you have bone spurs, calcium builds up in your tendons or ligaments, and they call it bone spurs. What is that? Well, that means you have chronic tearing in there. That means you have chronic inflammation that's building up calcium. So there's a reason that kidney has a calcium buildup. And finding out the reason why is the inflammation there in that kidney, and is the way to handle the problem. Instead of looking at the calcium, look at why is it there.
All right. Randy, who asked the question about his blood sugar, says he's laughing because he knew it was cortisol. All right. Alexander. All right. Here's another question. How is the best way to lower blood pressure? Mine is 167/77.
Okay. You know what? There's actually a simple answer to that question. In California, there's a clinic called the True North Clinic, and they did a huge study. Well, it wasn't huge. It was they went through a couple hundred people with high blood pressure. And they didn't look at why they had high blood pressure. They didn't care. They didn't look if they had heart disease. They didn't look at kidney problems, whatever else, whatever was going on. They just brought them in. Your blood pressure's high, and they fasted, and they fasted an average of about 2 weeks. And during those 2 weeks, 100% of them had normal blood pressure with no medications. You don't see 100% anywhere. You don't see that. You don't see any drug that works 100% of the time. You don't see any treatment. You don't see any surgery. Nothing's 100%. So what is that, 100%? Well, you ask, how do I lower my blood pressure? Without knowing anything about your blood pressure, I could say that if you were to do a water fast for 2 weeks, you would probably have normal blood pressure. Probably very likely because 100% in the study got normal blood pressure. The next thing that I would say though is what I usually do is I don't just tell everybody to fast. I go, okay, let's find out why your blood pressure high. Is it a metabolic problem? Well, then fasting actually works the best for if you have what's it, metabolic syndrome, with the central obesity, high blood pressure, high cholesterol. So yeah, and that would fix the problem entirely easily. And that's very common. But if you have renal artery stenosis, then you're going to have a stent put in your renal artery and to fix your blood pressure, and that would fix your blood pressure. If you have pituitary tumor, I just have had two of them
Wow.
recently. Pituitary tumors causing the adrenal glands to put out excessive amounts of norepinephrine, epinephrine, and they get high blood pressure is one of the issues, Cushing's disease. From high cortisol. So then you got to fix that. And it's really cool. They go through your nose. She had brain surgery and she has no cuts anywhere in her body. They go through the nose and they go up into the pituitary gland and they remove the tumor. It was so cool. And she's doing great now. She's like
Mm.
4 weeks out. She's doing great. So finding out why your blood pressure is high is a great way to do it. Otherwise, if you don't know, and just do a 2 week water fast.
Or we also have the high blood pressure solution kit, as I mentioned, with the diabetes solution kit. It's just something to help you follow and keep you accountable. If you need some extra help with that and fasting is hard, this might be a resource for you. I'll let Jody offer that link. Speaking of our products, someone has a question about berberine. It has been suggested many times on this webinar that berberine should be 500 milligrams taken 3 times per day. The berberine from Barton is suggested 1 capsule twice per day with food and serving size of 2 capsules. Each serving is 800 milligrams of berberine. How do you accomplish the suggestion of 3 times 500 milligrams per day? Great question,
That is a great
Alexander
question.
Rose. Yes.
Okay, so gosh, uh, there, there's things that are done for convenience, and then the way the research works is you have somebody who you have a captive audience in some way, somebody who's and they're relegated to doing it exactly the way you've outlined them to do it. So 500 milligrams 3 times a day because it needs to be spread out. But the reality is like nobody takes anything 3 times a day. Like it doesn't happen. Twice a day, you get a ton more, like the exponentially once a day, and it goes up a lot more. What we did is increase the dose, and then so you're getting actually more than you would 500 3 times a day in order so that you don't have dips in it during the day. And that allows you to take it twice a day, every 12 hours, and still have the benefit from it. So yeah, and it was really for practical reasons that was done. But yeah, you're right. The research does show 500. I should start saying, take 800 milligrams twice a day,
Yeah.
and that'll be a good idea.
If someone was taking our supplement 3 times a day with the 800 milligrams, would that be harmful in any way?
Oh no, not at
Okay.
all.
So, yeah. Well, Alexander, watch for some berberine sales. Then you can stock up is my suggestion as well. All right. Judy says, my blood sugar is not under control. I do eat sugar. I know I need to cut that down. It is between 125 to 200 plus. My pharmacist just keeps adding more insulin. She has me on 46 units a day. I also take metformin. I'm really worried that higher units of insulin is not healthy for my body. Kind of right, Judy.
You're right. You're right, Judy. That's exactly right. Insulin is not. So when you're insulin resistant, adding more insulin isn't the way to go because that's going to create more insulin resistance. So really what you want to do is to decrease the insulin because insulin, remember, is the problem. Insulin is more of a problem than blood sugar. Yes, high blood sugar is a problem, but it's not nearly the problem that high insulin is. High insulin is really all the damage that's done in the body, or the primary cause of all the damage is an insulin problem. So less insulin is better, even if your blood sugar is a little higher. So the idea is to do both. So here's what you do. Get the diabetes solution kit and start from page one and read it and write down your why and write down how you're going to do it and fill out all the paperwork and start and go to the store and take the shopping list with you and buy the stuff. That's what I did when I did the diabetes solution kit. I just started from the beginning. I went to the store. First thing I did is, okay, instead of looking at what I can't eat, all the stuff I like, I'm gonna just look, what can I eat? And I'm just walking around. I go, oh, look, shrimp. I haven't had shrimp in years. Oh, I can have broccoli. Yeah, that's fine. Oh, I can have asparagus too. I like asparagus. Oh, look, I can have salads. And so I just filled up my cart with stuff that I could eat that was on the list. And you know what? It was actually really easy to get started by doing that.
Judy, we would love it for you to give that a try. Come back and let us know how it goes. Or if you have any problems or anything that arises, come back. Dr. Saunders will answer any further questions, but just get started. Just go to the grocery store, get started. You can do it. Um, all right, so we have Fred asking, if you don't have a gallbladder, how is the liver affected?
Oh, that's interesting. So the liver is making bile acids, and this bile goes out into the intestines and dissolves the fat. So if you've ever looked at, like, it's kind of like soap, right? Soap, you have this fat, greasy film, and then you put soap in the sink, and it just like dissolves the fat. What does it do? Well, it makes it soluble in water. And so these bile acids are making fat that you're eating soluble in water, a water solution, aqueous solution, which is what's in your intestines, right? Um, when you don't have a gallbladder, then instead of the bile building up in the gallbladder, and then you eat some fat and it goes squirt and squirts all the bile acids out, now you have this constant flow of bile acids going into your small intestine. It's still there, but it's in smaller amounts and more constant. So some people have a lot of issues with it, um, if they eat too much fat, they don't dissolve the fat and they can't absorb it. So it goes down to the large intestine and creates a whole bunch of problems like diarrhea. So that could be an issue. But the question was, what happens to your liver when you don't have a gallbladder? Well, the liver keeps making bile and generally works pretty well and doesn't have issues.
Awesome. All right, we get this question a lot. What is the parasite that affects your liver? If it's true there is one, and how to get rid of it?
Okay. There are parasites that can get into your liver. I've actually been in surgery with removing some what were they? Cysts that were formed by parasites. Remember, I can't remember which ones they were. Um, anyway, yeah, there are parasites that can get into the liver, and then um, if they form cysts, then they often have to be surgically removed. That's because you can't get something to them because they don't have like a blood supply that's gonna get rid of them. And let's see. So other parasites that can get in your liver. That's actually quite a few parasites. Liver flukes can get into your liver, um, uh, uh, and those can be treated with antibiotics. And so there's antifungal, anti-parasitic medications depending on what it is that can be used for those. But it's kind of hard. Parasites are one of those things that are they hide a lot. And so if they're not causing an immediate problem, then people don't know they're there. Those like what Cheryl was saying about the hidden illnesses, that's it could be one of those.
I'm trying to put in the chat. We actually, oh, here it goes. We actually just came, oh, I turned off my video. We actually just came out with a Home Cures at Work article on parasites this month, so you should check that out. Someone asks, is arthritis a sign of liver problems?
Um, um, they can go together in the way that inflammation can cause liver problems and inflammation can cause arthritis. The thing is, they're kind of both like the canary in the coal mine kind of thing, where when you have inflammation, you get liver problems, and when you have inflammation, you get joint problems. And the joint problems can show up for a lot of different kinds of inflammation. So, autoimmune disease, you can have that kind of thing, or irritable bowel or inflammatory bowel disease. You think, oh, that's a stomach problem, right? And it's outside your body because, the intestines are the inside of the intestine is outside your body, so that should be separate. But actually, people with inflammatory disease, bowel disease, commonly get rheumatoid arthritis. So the fact that inflammation affects both the liver a lot, and the joints a lot, means that they go together. But if you have both liver disease and joint disease, don't think that one causes the other. Look for the source. There's going to be some third party that's the source. Is it an inflammatory or autoimmune condition, or is it high omega-6 to omega-3 ratio? That sometimes does it. Or is there some kind of infection or toxin? Looking for the source would be a good idea.
All right, someone posted in the chat that we need to come up with a cancer solution kit. Now, you can off the record say we haven't thought about this. We probably won't do it because there are so many factors involved. But in general, what would you put in there? Off the
Uh,
cuff.
okay. In general, um, I, I've had pretty good results with the metabolic causes of cancer. So, working on the metabolism of cancer by blocking the cancer's ability to make energy, and like avoiding sugar. I would put fasting in there. Fasting has been shown to be a great way to get rid of cancer, especially when it's early. Um, and depending on the type, I would put berberine in. Berberine blocks the use of sugar for energy, and since cancer can only use sugar, it can block the metabolism of cancer. I would also put some of the parasitic medications in there, and people have been using ivermectin and fenbendazole, mebendazole for many years. And I've seen some amazing successes with it. Recently I had somebody with stage 4 prostate cancer, and he's young. He's only 60 years old. And stage 4 prostate cancer, that's kind of like you're on your way out because there's no good treatment for that. But he decided not to do chemotherapy, did fenbendazole and ivermectin, and 3 months later, his MRI showed zero cancer, and now it's been a year, and he's still zero. And he told me, he said, "What am I going to do? I'm not a cancer patient anymore." Um, so, uh, I've seen people overcome cancer. The thing about cancer, and the reason we don't do something like the cancer solution kit is because it's so individual. And like different types of cancer have different metabolisms and different ways of doing it. And there are other websites that you can go to that have that kind of thing. You can look up the metabolism of cancer, and then you'll get a bunch of websites for that. And then the ivermectin, fenbendazole, they actually have a group now that they supply it. And so in the right doses, the right amounts. You don't have to go get it from the feed store anymore. It's like, yeah, that's why.
That's a good start. Thank you for that. All right. Dr. Saunders has been dealing with his online patients, and now it's time for him to go to his in-person patients. Thank you so much, Dr. Saunders.
Okay, bye.
Bye-bye. Now, there are more and more questions coming in that we don't have time to answer today about parasites. So, Jody, consider that as maybe a topic of conversation for a future webinar. But also, let's continue the conversation in the Facebook group. If you're not already part of it, it's the Barton webinar community on Facebook. Jody is so good at putting questions in there about getting conversations going, answering questions. So this is a community. And so I think the lady who was Judy, who wanted to lower her blood sugar, you know what, get started and then come back to the community for support, because many here have been through the exact same thing and have actually been successful. So we want to help you and support you, and just go find some other people to talk to about these conversations or other questions you have in that Facebook group. So thank you for joining us today. Come back next week, same time, same place, for a whole new webinar and a whole new conversation. See y'all there. Bye.